So we're going to go over palpations of the ankle today, and we're going to start with the metatarsal phalangeal joints. And so that's going to be down at the bottom where your phalanges and then your tarsal or metatarsals come together. So it's going to be right in here on all of them, and you can palpate them on the dorsal side or the plantar. And then the head of the first metatarsal, so that's going to be, your first metatarsal is the one next to your big toe, so it's going to be the one that's the most prominent to pick out. And the head is going to be kind of on the ball of the foot, so it's going to be on this side, and you'll be able to feel it and press down. It's going to be a good bump. The first metatarsal, like I said, is going to go all the way up, so it's going to be this long bone right in here. And then your metatarsals 2 through 4 are going to be these. So it's easiest if you start at the toe and then you can palpate up and proximal and feel all the way up them. And then your metatarsal heads, just like the head of the first, are going to be kind of under the toes, and they're going to be on the plantar side. And you can feel the bony prominence on the top, right there. So your first cuneiform is going to be, if you follow the first metatarsal up, you'll feel the joint line where they connect, and then that bone right above the metatarsal is going to be the cuneiform. Okay, so then right proximal then to the cuneiform is going to be the navicular tuber, and then on the navicular, the tubercle kind of juts out, and you'll normally be able to palpate it and see it easily as it points right there.
The next one is going to be the head of the talus. If you evert your foot, the head will just pop out. It'll be on the medial side, the medial head proximal to the navicular. If you can't find it, draw a line for the medial malleolus, malleolus to the navicular tubercle, and the bisect line and head will be located right there between your medial malleolus and the navicular tubercle. The medial malleolus is super easy to find when you're checking your hips. It's where you put your thumbs, right here on the medial side, large bony prominence on the medial side of your ankle. The sustentaculum tali is distal and posterior to the medial malleolus, about 1 finger's width. It may not be palpable, but it is the extension of the calcaneus. Shaft of the tibia, pretty self-explanatory right here in the front, runs distal to the knee. And you can start at your medial malleolus and work your way up, but if you start at your knee and work from the tibial tuberosity down, you can feel that down to your medial malleolus. The head of the fifth metatarsal, if you extend your toe, you'll be able to palpate that head just on the plantar side of your foot. To find the styloid process, you can start at the head of the fifth metatarsal, palpate toward the ankle, and you'll feel it jut out. It's near the base of the fifth metatarsal. The cuboid, if you palpate proximal to the styloid process, if you find that styloid process, then palpate just proximal to that, it'll be right there. It's a soft spot and indention where the cuboid lays, the navicular, or cuboid. Calcaneus is proximal to the cuboid, so if you keep going back, calcaneus is right here. It's a simple one.
The perineal tubercle is going to be inferior to the lateral malleolus, and it's located on the calcaneus, so it's right down here. And then the lateral malleolus is the protuberance on the outside of the foot here, easy to find. The shaft of the fibula, you're going to palpate proximal from the lateral malleolus, and you can follow it up as it goes. And the dome of the talus, you're going to have the patient invert and plantar flex their foot. So plantar flex and invert their foot, and then you're going to palpate medially adjacent to the lateral malleolus, and you can feel the dome of the talus right there. The sesamoid bones, you're going to palpate medial from the medial tubercle of the calcaneus and across the medial arch as well, and they lie over the metatarsal phalangeal joint below the first metatarsal. the medial tubercle is on the plantar aspect of the calcaneus, so it's down here. And the dome of the calcaneus, you're going to pinch the posterior aspect of the calcaneus, and you can palpate on the medial and lateral sides as you do that.
So for soft tissue, we're going to start with the tibialis posterior tendon, which is very common for athletes that have medial stress syndrome. So you're going to have them invert and plantar flex their foot, and it's going to be on this medial side, and you'll be able to palpate it behind the medial malleolus, and it'll kind of pop out, and that's going to be part of Tom, Dick, and Nervous Harry. And then the flexor digitorum longus is also going to, all of these are going to run right along this medial and behind the malleolus. So this one you're going to have them flex their toes, that's extending, and have them resist, and it'll pop out on this side also, and you'll be able to feel it. Flexor hallucis longus is going to be for your big toes, so you're going to have them flex their big toe. And then you can see it as it juts out also right behind the malleolus. The posterior tib, artery, and vein and the nerve are all part of Tom, Dick, and Nervous Harry, and they're going to run also right along there. You can do like Tunnel sign to hear, like, to get the nerve to spasm like that, or you can get a pulse back there. They all run right in there. And then you also have the deltoid ligament. So that's going to be your deltoid, which is what connects all of it, and so it's going to form a deltoid around your ankle. And then your spring ligament spans between your calcaneus and your navicular, so it's going to come right in here. And for some people it's super easy to palpate because it'll jut out if you have them like push against. And some you can like feel it as it pops out right in there. And then your long spinning vein is anterior to the medial malleolus, so it's going to be right in here.
Alright, to palpate the tibialis anterior tendon, you're going to have your patient dorsiflex and invert their foot, and it pops out really prominently right here. And it will be more prominent as it crosses the joint line. The extensor hallucis tendon is right lateral to the tibialis anterior tendon. So you have that one here. If you have your patient resist toe extension, you can see it pop out. So that one's right here, and then the anterior tibialis is right here. So they're right next to each other. The extensor digitorum longus tendon, it is lateral to the hallucis tendon, and you can see it if you resist toe extension. You can see them. They can all splay out right here. You can see the little band right here, and then they'll splay. You have great feed for this. The dorsal pedal artery is between the extensor and the hallucis digitorum tendons. So your dorsal pedal pulse is right through here. Kayla is not alive. The anterior Talofibular ligament is not actually palpable, but if you palpate the sinus tarsi area, it's right here. The Calcaneofibular ligament, again, it's not palpable, but if you palpate the inferior angle of the lateral malleolus, which is actually right over here, you can palpate that.
The posterior talofibular ligament is not distinctly palpable, but it is located over the posterior edge of the malleolus and posterior aspect of the calcaneus, so it runs through here. The peroneus longus and brevis, you're going to have the patient evert their ankle and plantar flex, and you're going to be able to palpate near the inferior angle of the lateral malleolus, so right through here they should be palpable. The tertius is not distinguishable, but if you palpate posterior to the styloid process of the fifth, that's where it's located. The Achilles tendon is the thick cord superior to the calcaneus, so Achilles back here. The retrocalcaneal bursa is, you're going to pinch your fingers together anterior to the Achilles tendon, so it's right through here. And then the calcaneal bursa, you're also going to pinch your fingers together, but posterior to the Achilles tendon. And then the gastroc and the soleus, you're going to locate the Achilles tendon, and then you can palpate proximal toward the knee, and it's pretty palpable through there. So